Jeanette asked me to ask you about taking vitamin K2 along with D3. Can you comment on that? And while we're on the topic, calcium for postmenopausal women.
Absolutely. An excellent question, by the way. And the problem with calcium is that doctors were recommending people take high dose calcium pills, like 1,000 milligrams of calcium or 1,500 milligrams of calcium a day or 1,000 twice a day. And taking high dose calcium at one time spikes too much calcium in the blood, and too much calcium rushed into the bloodstream it could be deposited where it should not be deposited, like in blood vessels or in the heart, or And so we're talking here that we no longer recommend calcium supplements, but we do recommend for postmenopausal women to take a low dose of about 150 to 200 milligrams of a food-based calcium added to a meal. So they're just because, they're at prone for osteoporosis, and which is a normal consequence of aging. It's not a disease necessarily, osteopenia. It's normal to lose muscle mass with aging and to lose some bone mass with aging. We're trying to resist that from happening. You're going to never maintain your youthful bone mass and muscle strength. We're all going to lose some as we age, but I'm exercising in the gym and using the power plate and trying to resist that from happening. And also postmenopausal women paying attention to that and eating their green vegetables, chewing them really well, and taking a little bit of calcium with the meals, particularly if you can get a food-based calcium, so it's absorbed more slowly and doesn't spike calcium in the blood that can show the side effects that we've seen with people taking more conventional calcium supplements. So I do recommend that. And and taking a little vitamin D and K2 mixed together seemed to be beneficial in most of the studies on this subject, showing better bone mass, better results when adding K2 to the calcium. Except I'm no longer sure about that, because it seems that when people are eating as healthy as I recommend, and you're getting a diet with so much K1, and then you're getting so much nutritional diversity of healthy bacteria in the gut, it seems that a person with a healthy gut can make enough K2 from the K1 you're eating and the bacteria and the healthy bacteria milieu in the gut. So I'm kind of minimizing my idea that K2 is so important to supplement when the people are already eating so healthily. You know what I mean?
Yeah. But a lot of people are eating healthier than the norm, but not quite at the optimal peak of everything you recommend. So there is a range there, obviously, and that's where sometimes supplements can help bridge some of that gap. And just to be clear, if everyone isn't, K1 is abundant in the plant kingdom. K2 is not. It's in natto and a few fermented foods, and it's in animal products. We can make K2 from K1 in our guts, but it's there's no good test for K2 widely available to assess our levels, and it does seem to be associated with a range of health benefits, including fighting osteoporosis or helping strong bones. It seems, to put it really oversimply, that vitamin D helps us to absorb calcium that we consume, and vitamin K2 helps us to shuttle it, if you will, into the bones, get it where we want it, and away from the arteries where we don't want it. But
Correct.
these are general principles, and as you're saying, with an optimal healthy diet, you may get plenty of calcium from your food. You may get D from the sun, possibly. Certainly, you can get K2 from K1, but a little bit of these things can be beneficial also just to make sure that you're okay, but a overabundance maybe not necessary or helpful.
That's correct. And we have seen studies that showing that the little bit of extra calcium with a little bit of extra D and K2 has bone benefits for women. Definitely, we
Yeah.
see benefits for women, right? So,
And we do see higher rates of hip fractures in vegan women postmenopausal than omnivorous. And so this is one, but when they take small amounts of calcium and D and K2, those disadvantages evaporate and their bones get stronger. So,
now, I've seen those studies too, but I've analyzed the diets that these vegans were eating, and they were not
uh-huh.
eating a nutritarian diet. They were
Yeah.
eating, and I put on my website and my blog once that the analysis of the diet, compared to the nutritarian diet that includes beans and nuts and seeds and green vegetables, and showed, well, double the calcium,
Mm.
much more protein, much more, in
Yeah.
other words, the dietary quality was so poor in some of these vegans So I don't want people to think that it was the vegan diet per se. I mean,
Yes.
you can design
Yes.
it, but in any case, part of the whole picture, right? We're looking at.
Yeah, really, we're looking at a standard American diet version of a vegan diet, which
Yeah,
is
exactly.
no real benefit.